Hello, how you doing? I'm Dr. Matt Young. I'm president of the American Academy of Implant Dentistry. Today, we're going to be talking about our annual meeting. This is going to be in Phoenix, Arizona from November 12th to November 15th. We have an awesome main podium program. We have great workshops, and we have awesome opportunity for camaraderie, social networking, and we also have great opportunity to meet our newly credentialed members. Dr. John Minichetti and Dr. Brian Jackson have developed such an amazing program with our annual meeting committee. Today, I get to talk to Dr. John Minichetti himself. He has done so much for implant dentistry over the years. He's a maxi course director, trained hundreds of dentists, maybe thousands of dentists, one of my great mentors for the last over 20 years. And he's inspired so many of us. He's our annual co-chair with Dr. Jackson, but he's also running a workshop, a cadaver training workshop. This is one of the best hands-on opportunities out there. So, Dr. Minichetti, I'd like to have you tell us about your workshop, what the attendees can expect, and tell us about the program.
You got it, Matt. Thank you so much for getting me on. And thank you and congratulations to this year for you being the president of the American Academy of Implant Dentistry. I know you're doing a fantastic job for the organization and kudos to you.
Thank you.
So, yeah, thank you. We are reinvigorating the cadaveric program. We did have this program years ago. And then with COVID, things kind of fell apart, but we're getting it back into the kickstart. And so this is the first time in many years that we're going to bring it back. What is the cadaver program workshop about? Well, it can be for clinicians interested in some basic implant training or advanced implant training. We go through all the phases as we go through the specimens. We've been doing these programs now for over 15 years. They developed from just an anatomic program to now really a more practical program with anatomy as a component towards the end. So usually the sequence for these programs are start with edentulating some patients. You know, you'd put immediate implants in. You place implants in edentulous, previous edentulous sites also. So those are the beginners type of steps. From there, we can do socket grafting and socket preservation techniques, atraumatic extraction techniques. And we go with each step through the parts. We can then start reducing ridges, do full arch extractions, do sinus lift augmentation type of procedures. There's the opportunity to ridge expansion or ridge splitting type of procedures, bone manipulation. We have bone grafting or block grafting, either allograftic or autologous block grafting we can do. And then, of course, dissection at the end, where we are done with the specimens and placing implants, then we can look for anatomic structures that are very important to the implant dentist, such as what? Inferior alveolar nerve, the mental foramens, the mental nerves. We could take it to the facial nerves. We take it to the lingual nerves. These are structures that we identify: greater palatines, nasal palatines, etc. And we have a training program, an hour or so of a lecture and reviewing all that anatomy prior to start. So it's a real practical approach to hands-on dentistry, and it's a good opportunity.
Well, it's an awesome way to jumpstart your career if there's procedures that you haven't done before or want to do more of and want to have somebody there with you throughout the whole time. This is an awesome course, an awesome program for you. I've taught this class many times with you over the years, and it's such an awesome adjunct to the lectures, to the hands-on program. So some of the things that you look at. You can let us know at the morning of the program, what kind of procedures you like to do. And, we have really awesome abilities to get those going and great faculty. You have a team of faculty, don't you, for this?
I do. One of them is my daughter, Dr. Karen Minichetti.
Nice.
She's going to be in there. We have Dr. Alan Garashi and others helping us out. So we'll have the proper faculty to student ratio as we need to have for that program. So it's wonderful. We're
That's
also
awesome.
lucky enough to work with some great sponsors. So we're going to get to use some equipment that you can use. You can't maybe use these things on a pig jaw, etc., but you get to use it on a cadaver, such as the piezo surgical units. Very practical for, I know you utilize that a lot in your practice,
Yeah.
for atraumatic extractions, for ridge expansion, for block um, um, procurement, whatever, even the sinus lifting. So we do get to utilize those instruments. Of course, we have bone screws for block grafting, get to utilize those instruments. The osteotomes, the surgical crestal kits, the lateral window kits. You get to play with a lot of stuff that, you see it in the exposition areas or the exhibit areas, but you really don't get to play with it and touch it as much. Here you can actually use it like it's on a live patient, get a feel for it, get an idea of what these instruments and armamentarium are about, and you may want to utilize them later on in your career.
Well, it sounds awesome to have the main podium, the other lectures and workshops, and to bring it all together with a hands-on program really connects to the annual meeting and really can drive your career and get you to the next level.
I'm so excited about our meeting in Phoenix. It's going to be good weather. You picked a good spot for November, I'll tell you that much, dude. It's going to be nice. We're going to have an outdoor, right? Where we have some kind of street type of thing going on as one of the intro parties, I believe. And
Yeah.
we're going to have the president's celebration. It's going to be outrageously wonderful, celebrating your achievements for the year. We'll be uh, uh, welcoming all our newly credentialed associate fellows. I think we
Yeah.
have a super big number. We have our
Yeah.
fellows, we have our diplomats. This year, the diplomat um, organization is going to have their ceremony not at luncheon, but in the evening. So it's a new program with a new look. They're going to actually I hear they're honoring the past presidents. Woohoo! Past presidents of the AVO are going to be honored, as well as all the diplomats and those who have supported this great certifying organization over the years. So I'm really looking forward to this year's meeting in Phoenix.
John, you've done so much for the Academy. You're past president of the American Academy of Implant Dentistry and past president of the American Board of Oral Implantology. You're passionate about your patients. You're passionate about implant dentistry. You're passionate about teaching. Why do you put so much effort into the AAID? What is it that makes you passionate?
I
Yeah.
often ask that. I have no idea.
Yeah.
Of course. Hey, I love the ID. The AID is, when you get back whatever you give, that's a true statement in life. So the AID's done so much for me. I mean, it's helped me grow. That's where all my mentors were. That's where I sought knowledge to advance my skills. That's where I got the satisfaction of bettering myself, credentialing myself, showing the public that I was qualified, that I was committed to this
Yeah.
field. And you got to pass that on. I mean, what else is there in life? You just got to pass it on. And that's whatever AID gave to me, couldn't possibly give it back. It's a wonderful organization, the friends, the camaraderie, it's my family. That's basically what it is. It's my family. So you always give back to your family. Family first.
Well, I love it. You have a great family, and your dental family is awesome and keeps growing.
Yeah.
Keeps becoming more and more enthusiastic. So
Yeah.
look forward to seeing you in November. Look forward to seeing everybody in November. AAID, November 12th to 15th, Phoenix, Arizona. It's going to be awesome.